Hello, my name is Annette. Welcome to this Monday's MYM movement. Today I'm going to show you how to release a muscle called the TFL, which stands for tensor fascia lata. And it's the primary muscle at the top of your IT band. So it comes off of the hip bone, the crest of your hip, and comes down, attaches to the IT band on the very outside aspect of the thigh. And it fans, so it comes a little bit more towards the front. And when you feel around below the hip bone and above the fold of the hip, you'll feel this kind of strappy area that feels like it's kind of a tendon, but it's not. It's just fairly tight muscle and fascia. And we're going to go there to the outside of the hip so that we get kind of the thickness of it going across. And so when we release this, it can have a really positive impact on the alignment of our knee joint. And as well, because it can take the hip into some really misaligned positions, it can also have a really positive impact for people who have that kind of upper hip, upper glute pain. So it's terrific for helping to release you into alignment so that those two spots have less misalignment and pain. So I love to use something called an orb. It's my favorite tool for the hips. And it's a firm foam ball. But if you don't have access to one, of course, you can use a tennis ball. It works pretty well. I'm going to demonstrate with the orb, but you can do the same thing with a tennis ball if that's what you have. So we're going to come onto the side, and I'm going to place the ball on the very outside aspect of the hip. It's below the hip bone, and it's above the fold of the hip, okay? And I'm going to begin by crossing the fibers from outer to forward. So I'm going to just kind of do a little bit of compression, moving from that outer towards the front. And I'm keeping my legs stacked, which will bring a little more pressure into that area. But if it's a little bit too much for you, you can also place that top leg so you press through the leg and you can unweight this just a little bit. So this tends to be quite tender for most people. So being able to unweight it is important, okay? And you want to be able to stay in the realm of tolerable pressure so that you're not just having a pain response to the pressure. And so I begin with this rolling, and I'm doing it slowly. So I'm always in that somatic awareness, the feeling state, because our nervous system is responsible for holding tension in this area and all of our connective tissue and muscle. And if we don't calm the nervous system and really bring it on board for the process of release, we either won't successfully release or we won't hold the release. So bringing the nervous system on board is really important. So I love to cross those fibers from outer towards the front. And then I'm noticing as I'm rolling that there's some particularly tender spots. So as I go through this movement to both start to release and get rid of some of the adhesions within that, and also taking note of where there's more tension that I could spend some time on releasing. So I'm going to find my way to that spot that I know really works for me. And I'm either just going to stay in stillness, or I can enhance the pressure and get in a little deeper by lifting that bottom knee and releasing it back down. And just one time is enough. And then staying here in the moment to just really feel and experience the pressure there. And I'm beginning with an awareness of resource within my body through the movement of the breath. So a place within my body where I innately have this feeling of well-being, and my breath is a very, very accessible tool to really feel that all is well despite discomfort that I'm actually eliciting in my body. So slowing that exhaling breath down and then finding that really fluid, rhythmic, circular breathing. And as I focus on a complete release on my exhale, I'll probably start to notice that the inhaling breath naturally comes in fullness. And as I notice that, just starting to track that circular breathing And then from that resourced place within my body, I'm going to shift my awareness to the discomfort very intentionally and just being there in the moment with it. And I'm not trying to change it. I'm just being very present with all the sensations that arise and just continue to track them as they do. And you'll notice as you're just in the moment with whatever is, you are non-resistant to the resistance that is actually there. And so without a pushback, you can start to get this sense of release, and you'll start to feel things shift in that area because we're not being resistant to the experience. So there's this kind of slow release valve that happens as we stop our resistance to the experience of tension. So just being with it however it is. Right, when it gets a little intense, to be in that awareness, notice your breath again, resource again. And then last time, draw your awareness into that physical spot where we're applying pressure. And be really in the moment with it. And notice your breathing slowly come off. And take a moment to notice how it feels on one side and the other. And so we're not only in the moment as we're applying the pressures so that we can engage in this non-resistance to allow it to shift, but then being in the moment to actually experience the change that's happening. So you can feel how when we release this, you can feel what it's like to relax and not have tension, what it's like to soften. And you can juxtapose that with the feeling that's happening on the other side and really connect into this. And then when you transfer to the other side, then we'll have that same feeling come slowly to this hip. And then you can experience how the hips start to soften as a result of being very much in the present moment with what you're doing. So I invite you to do this, really profound for knee pain. I've had a lot of clients who've had a lot of relief in their upper hip area or low back, below that hip bone. And with this exercise, it can really profoundly shift the alignment so you can find more steady positions and functional movements. So thank you for being here. Namaste.
If you liked my video, please hit the subscribe button below. It helps me to continue to serve you and others.